this evening, this early evening, with another video. Please, if you're not subscribed to my channel, please hit the subscribe button. Please hit the notification bell so you will get all things DutyRon when I go live. Again, I am a retired New York City police detective with 20 years service in the New York City Police Department. I talk about police, crime, and current events. We are now tonight talking about the coronavirus, COVID-19. We all are affected throughout the world with this virus. The cases here in the United States are soaring, well over 100,000 confirmed cases in the United States. And we also are looking at approaching astronomical numbers worldwide. So we have all great concerns. I want to say thank you to each and every one of you for joining. If you can, share onto your social media. What I have here for you tonight is valid, viable information from a doctor. This is an interview that was pre-recorded on March 22nd. Because it was recorded in the past doesn't mean that the information is not valid here in the future. So I want to say thank you to all of my Patreon supporters, my channel members, the people who subscribe to this channel. I try to put out the most valid information with facts, and I do a lot of research for you guys so we know what we're talking about when we go live. So I do put a lot of I put a lot of research and a lot of time and effort in this for your benefit. Hello, Joey Brooklyn. Thank you for joining. Guys, this is going to be a video that I'm going to let run, and I'm not going to be speaking on. This is Dr. David Price from Cornell Medical Center. Some of you might have already seen this video. I think it's important that you watch this 35 minutes of this video. It's only 35 minutes. I think it's very important that each and every one of you watch this, because this will stop some of the fears and misconceptions, because you'll be getting it from an ICU doctor, a doctor that works for a very premier hospital in New York City, who is seeing multiple COVID-19 cases. He's going to tell you in no uncertain terms the do's and don'ts on how to keep your family and yourself safe. So if you want to try to educate yourself and keep yourself safe, this is a video that all time, through all of my research in the last 3 weeks, this is the best and most clear and concise information on COVID-19, the coronavirus, coming from a doctor on the front lines. You can't get any better than that, ladies and gentlemen. This is a guy who is seeing patients day in and day out, and he's going to tell you on no uncertain terms what is going on. All right, guys? So I hope everybody is well. I hope the sound is good on everyone's end. Premier Hell, welcome to the DutyRon family. Thank you for joining. So when I put this video on, I will not be speaking to you guys. I need each and every one of you, especially the people who are uneasy and are not feeling comfortable about what's going on. I need each and every one of you to listen to this video and watch it. Joey Brooklyn,
welcome to the DutyRon family.
Joey Brooklyn, do we have audio? We have audio. I could see the audio. Whoever's not hearing me, just go out and come on back in. Trash and Treasure, thank you for coming. Thank you for everyone being in here. I want to play this video for you guys. I'm not going to talk during the course of it. Hello, Dookie. I think it's important that each and every one of you listen clearly to this video. It's a pre-recorded video, and it has so much good information. This is for educational purposes. This is for my family. I'm going to sit down and watch this with my children, with my wife, and I encourage each and every one of you to pay attention to this video, watch clearly, and listen to what the doctor, Dr. David Price, his wife or one of his family members, was kind enough to create this video. And I want to say thank you to Dr. David Price of Cornell Medical Center. They are seeing the highest cases of COVID-19. Their entire hospital is shut down to regular patients. All he is seeing is COVID-19 patients. And this video, 35 or 40 minutes, is a chock full of information. It blew my mind earlier today. When I came across this, my mind was blown. Thank you, Paul Peck. Thank you, Joey Brooklyn. All right, Premier Health, thank you for becoming a member. Karen Wise, good to see you. Red Like Wine and everybody. Here we go. I'm gonna start this video, and then I'll be back when it's done. I'll be back when it's done. All right, guys, please pay attention, and then there will be a question and answer period at the end of this where people ask a lot of really good questions. He'll talk about the ventilators and what's going on in the city hospitals, and he'll talk about supplies. And it is not the best of videos. It wasn't done in a professional way, but this is a really good video for you guys to have information. So I'm going to play it right now in its entirety. All right, you'll still see me in the corner right here. So this is Dr. David Price. Some of you may have seen this video already, but for those of you who haven't, outside the country, inside the country, United States, this is a very, very informative video. Educational purposes, I think it's important that each and every one of you see this. Each and every one of you see this. This is very important.
About 20% of the volume of COVID patients through the city. And so technically, as an ICU doctor, patients will come to the hospital, see someone like my dad. We'll decide if they're sick or not. If they're good enough to go home, they'd never see me. And then if they are sick, then they'll come up to the floor. And then if they're very sick, then that's when someone like myself will get involved. And so my job is to decide which patients need ventilators. And once patients are put on ventilators, how long they have to stay on them, the treatment of these patients. And so my whole long-winded point is that I'm kind of in a unique position to kind of comment on what's going on. But I think the first point I want to make is, why are we having this phone call, or why did I think it was important to have this phone call? I think in the medical community, especially for people on the front lines, there's kind of two thoughts right now about kind of interacting with your family and talking to your family about what's going on. The first is to get angry. And I think that I think a lot of doctors are looking around the country right now, especially doctors in New York, and thinking that people aren't taking this seriously. There's kind of a desire to scare people into kind of getting serious. But I was working last night, and I think that there's a second kind of feeling out there right now. And I think that this is what I'm feeling right now, is that doctors like myself are in a very unique position to actually empower people right now. And what I mean by empower is to learn about this disease. I know you guys have a lot of questions, and we will get to as many of these questions as we have. But the reason I want to have this call is because I don't want you guys to be scared. We're 3 months into this in the medical world, and we understand this disease. And so I'm going to go through kind of ways to protect your family, and then what to do if and when, given the size of this call, it's a when, someone gets COVID, and how we can protect our circle. You may hear a little inflection in my voice, like I'm emotional. It's not because I'm scared. It's actually the opposite. For the first time in a while, I'm actually not scared. And so I'm going to share with you why that is. So just a quick introduction as to what's going on in New York. I work at probably the premier hospital in New York City. It is a 1,200-bed hospital. We do everything from surgery to transplants, lung transplants, heart transplants. At this point, we do none of that. Almost none of that. Our hospital is almost exclusively a COVID-19 hospital. And so people enter through a secure gate in the front, where in the past, what I've been doing is seeing old people with pneumonias or seeing people with bleeds. Almost exclusively what I do all day long is see people with COVID-19. But we're learning and we know a lot. And what I want you guys to know is that every single day we're getting better. We know more. And I am confident that the stuff I can tell you today should make you guys feel like when this comes to your community, that you don't have to be scared and that you can protect your family. Before I start, I just want to say thank you for everyone who responded to all of the mask requests. It was overwhelming. I'm receiving masks pretty much every day now. We still have a severe shortage, but it's something that is improving every single day. And I think it's just really great to know that
but he
I
talks
have all
about
you guys
the
behind me.
non-need for the masks.
Okay, so let's get into stuff that's actually helpful for you. So the first thing is just, what is COVID-19? I mean, it's now every single news story. It's political, it's economic, but what is this disease? So this is a virus. It's from what we would colloquially think of as a common cold family, the coronavirus family. But what's unique is that the human body has never seen this virus before. And so this obviously started in Wuhan. The thought is that it came probably from an animal and then made its way into the human body for the first time. And so one of the common questions I get is, what does this disease
Thank you for the super chat, Josh.
And so what commonly people have is they have fever and they have cough and then they have sore throat. And when they get this, the virus goes through their entire body. And what we have found is that the most likely place that this will affect is your lungs. And so people will commonly have cough. But for about 80% of people, you just don't feel good is the most common thing. You have a mild cough, maybe you have a little headache. The disease lasts, from what we're seeing, between 5 to 7 to 14 days is probably the best accurate description. Some people who have a mild disease by about day 5 are starting to feel better. And then people who aren't feeling better usually start to get short of breath around day 3 to 5.
Thank you, Heidi, for the super chat. Thank you.
And then start to feel better around that 7-day mark. And so what is the first kind of big topic we're going to talk about? And I think the reason I wanted to have this call is how to protect your family. And I think we've learned a lot, and I want to kind of share all the stuff that I've learned so far with you guys. So I think the first thing is, how do you get COVID? And I think that this is really important, and we've really learned a lot over the last couple of weeks and months about how you get this disease. And so the overarching theme is sustained contact with someone who has this disease, which the vast majority is people with fever and aches, or someone who is about to get the disease. So someone in the next 1 to 2 days who's going to develop symptoms of this disease. And so the way that you get this is the transmission of the virus almost exclusively from your hands to your face. From your hands to your face. And so it's either into your eyes, into your nose, or into your mouth.
Okay, I had to stop it right there, because anybody that knows me, anybody that's been paying attention to what I've been saying, this is exactly the exact thing that I've preached on every one of my COVID-19 and coronavirus videos. Now I heard it today from a doctor. I read about it, but this is what I've been speaking about on every single video that I do. This virus, your contraction rate is very high through the ear, the eyes, the nose, the mouth. I had read that it was through the ears, but he says no. So eyes, nose, and mouth from your hands. A high percentage of coronavirus patients contract coronavirus, not through the air, not through spit, through their own self-contraction. So I'll let the rest of this play.
So there's a lot of talk about contact or getting it through contact, hands to face. There's also a small thought that it can be aerosolized, that it can kind of exist a little bit in the air. The thought at this point is that you actually have to have very long, sustained contact with someone. And I'm talking about over 15 to 30 minutes in an unprotected environment, meaning you're in a very closed room without any type of mask, for you to get it that way. But to very simply state, the overwhelming majority of people are getting this by physically touching someone who has this disease or will develop it in the next 1 to 2 days, and then touching their face. And so that actually, I think, is incredibly empowering. And that's, as I've been in the hospital the last 2 days, the thing that makes me smile a little bit is that I actually know now that I won't get this disease, because I know how to protect myself. And so I just want to give you guys a few very, very practical tips to how to protect yourself. So the first point, before I get to that, is something.
Okay, so there was a little technical difficulty on the video, so I'm going to skip forward.
Okay, Dave, go for it. Sorry about that. Thanks,
I'll
Alex.
save you all the.
Okay, a simple statement of fact. COVID is in your community. I'm going to say that again. Whether you live in Texas, whether you live in Tennessee, whether you live in Florida, it is in your community right now. That is not to scare you. That is to just tell you so that you can then take the steps that I'm talking about and not be scared. So the first step, which I think is incredibly clear, is to become a hand Nazi. Know where your hands are and know that they're clean at all times. So very simply, for what this means for me in the city, is that I walk around with Purell. Is someone not muted? I think. So walk around with Purell. And so when I leave my apartment, everything that I see that I'm going to touch, I make sure that I Purell first. So when I leave my apartment door and I go to the elevator, it's okay that if I touch it with my hand, but then I Purell it. When I go downstairs and I open the door, it's okay to touch the door. You can open it with your elbow, but if you touch the door, then I make sure to Purell it. So we know that if you keep your hands clean, that you're not going to get this. The second point is that this is not a disease that we're getting because someone is sick and touched something, and then an entire community of 10 people get it because they touched that. It's mostly from sustained contact with people who have COVID-19. Out of abundance of caution, we also make sure that everything we touch, we're cleaning our hands. So that's the first thing, is become a hand Nazi. Everything you know about your hands, just keep them clean, and you will not get this disease. The second thing is you have to start psychologically working on the connection between your hands and your face. So I'm terrible at this. I touch my face all the time, literally all the time. You don't even realize it. You move your hand, you scratch your nose. And so the virus has taken advantage of this. And the reason why everyone gets this disease is because you have sustained contact with someone. So someone at a party has this and you shake their hand, right? And then you touch your face. It's that simple. That is how you get this disease. So what does that mean? I think there's two practical things that you can do. One is just to start to be aware of when you touch your face.
Again, this is a ICU doctor from Cornell University, Cornell Medical Center in New York City and Manhattan, a premier hospital. This is coming from a doctor who's seeing hundreds, perhaps thousands of patients. And this is coming from a medical professional. I don't know about you guys, but I go with what a doctor has said to me as opposed to some rumor that I heard on the internet. So I listen to a doctor before I listen to some jagaloon giving me advice. Anybody in the medical field has good, valid information, but this is coming from a doctor on the front lines that is seeing the most amount of patients out of anybody probably in this country, in the United States. So I listened to this guy.
Atul Gawande, who is a Harvard-trained surgeon, I think is very famous, actually has a recommendation for people to just start wearing masks. And the idea here is not that the mask is going to prevent you from getting COVID, because as I said, it's not a disease that you're most likely getting from the air. But the reason to put on a mask is because, and I do this in the hospital, is you stop touching your face. And so what I would recommend is now when you're leaving your house is to wear a mask. And I think those two things combined is incredibly powerful and will prevent the transmission of the disease into your family in 99% of cases. To know your hands are clean and to not touch your face.
He just said 99% of the cases can be eliminated through hand contact to the face. That's empowering in itself. That's relieving to me, because now when I interact with somebody, someone who delivers food to me that's out there on the front lines, I feel better. I'm not going to sit there and take breaths from that guy. I'm not going to get in close proximity of him, but I know that if I wash the crap out of my hands after having a contact with anything outside of your protected zone. Now, our protected zone is our house, providing you keep it clean. So you need to keep the inside of your protected zone clean, because if it's dirty and it's contaminated, that's why you can't have people come over. You can't have, the only people that are in my house from now until this is over is me and my family. That's it. No more. Nobody else.
Period. There are going to be an obscure 0.01% of patients who get it and will just never know. But I think for you, that is an incredibly important way to protect yourself. 3, you don't need a medical mask. You don't need a medical mask. These masks that people are wearing are not protecting them from getting the disease.
Thank you.
And front care healthline workers need these masks right now. That's not to say don't wear a medical mask. If you have one, that's great. Put it on. But it doesn't mean you have to have a wild supply of masks or N95s or anything like that. The general community has zero need for an N95 mask. Zero. In the hospital, where all I do is take care of patients with COVID-19,
0.0.
I only wear a mask, of N95 mask, if I'm in the room with that patient doing something that's going to make them have aerosolization of the virus. That is no one in the community. So to summarize, always know where your hands are. And what I mean by that is when you leave, just become aware of when you're touching stuff that's not from your protected home environment. So if you're going to go to the grocery store,
bingo.
If you're going to touch the cart, just clean the handle. If you go into the store and you see people around, don't touch them. It's incredibly simple. The fourth thing that I'll say, which is the thing that the government is talking about and kind of is the same principle, is distance yourself. And so this is incredibly fascinating in New York City now, is that nobody is going within 3 to 6 feet of each other. And it actually has not changed our life that much. And so I think when you go to the pharmacy, because people are going to the pharmacy now, you don't have to wait directly in line with someone. You can stand a couple feet back. And so the 4 things, I think I said 4 things. Always know where your hands are and have Purell. When you touch stuff that's outside your home, just make sure that you're washing your hand. Start to learn how to not touch your face. A really good way to do that is to start wearing a mask when you're out. And if you want to practice, wear a mask when you're home. Number 3 is you don't need an N95 mask or a medical mask. Any mask will do, because this is not preventing the disease. This is training you. And then the 4th thing is just stay away from people. So that's the nitty gritty of, not stay away from people, stay 3 to 6 feet away from people. So that is the nitty gritty of not how to give yourself this disease or get it from your community where it is at this time.
The most important thing he's going to talk about is coming up shortly.
When you understand those 4 rules, the next thing that I think is so important becomes true. Oh my God.
A little bit more technical difficulty, and then we come right back.
Good?
Yeah, sorry, Dave. Go again.
Yeah. You don't have to be scared of the outside world now. You don't have to be scared of your neighbor.
Listen to
and
this,
I've actually found that to be incredibly liberating right now.
This is
so
a
in New
doctor.
York City, we're receiving food from delivery men. We have to go outside to the grocery store. It's a time when we're all really scared. And I think it's what makes it worse is to when you go outside and to look and think that the person next to you is going to somehow harm you or harm your family. But when you know that the only way you're going to get this disease is if your hands are dirty, and that if you touch your face,
this is important.
and that if you are way too close to that person, that becomes incredibly liberating. And then all of a sudden, the person at the store is not your enemy. There's someone who's going through this with you. The delivery person is not your enemy. They're a hero. They're going out and delivering food at a time when there's a communicable disease that they don't understand.
Amen, Doc.
The mailman is a hero. These are people that we have to, the same way we're acknowledging and celebrating healthcare providers. When you understand this disease and know exactly what to do to prevent getting it, then it allows us for the next couple of weeks to months to be able to sustain the system that we have. We have to be able to have mail. We have to be able to get delivery and seamless in New York City. It's the only way we eat. But if you can protect yourself and you know your family's safe, then I think that's empowering. Socially, it's incredibly important, and we did this at my mom's house, is you have to shrink your social circle. And so what does that mean? So in our family, I think you guys know that my parents live on a farm. We had a lot of traffic through the farm. We had families who come and see the horses, who ride the horses. But you have to understand that every person, every one of those people have potentially 2 or 3 other contacts and 2 or 3 other contacts. And so what I would highly encourage you guys to do as the country is shutting down is find your isolation group, find your group of 3 people, 4 people, your family, and set boundaries. That is it. The people who are going to get this are people who are maintaining large social circles at this point. So what did that mean for my family? Is so Gene Young and our kids and my mom are on the farm. They're at the Hopewell house. And that is exclusively the social circle that they're circulating. They talk to their family every day. They see people, like through FaceTime, but there's no one coming in and out of the house. They can still go to the store, and you can go to the store without any fear because if you wash your hands and you don't touch your face,
bingo,
you're not going to get this disease. And so it's very important at this point to keep your social circles small. Don't be going to the Elks Club or the Elks Club, excuse me. Don't be putting yourself in a situation where you have a lot of contact with a lot of people because it's just a vulnerability. You don't know that the person at the farm who you slapped hands with 2 days later will not have this disease, because then that means that you're going to have to socially isolate at that point even more. So that is the simple how do you prepare. So the third thing that I want to talk about is something that is inevitable in a group chat that's this large, which is, what do you do if you get this disease? And this is, I think, if you listen to nothing else through this entire thing, just please listen to this part. In Wuhan, China, throughout the world, the vast majority of spread of COVID-19 is through home and family transmission. So I'll say that again. Throughout the world, the way this is transmitted is from husband to wife, father to son, daughter to brother, whatever. And so, again, that's incredibly scary, but it's also something that if you understand the rules, is incredibly empowering. So what do you do? If you develop a fever and you are otherwise fine, and isolate yourself from your family. So what does that mean? It's just simply about the same rules about hands and touching your face. Is you don't want sustained contact with the person who's sick to the point where you're going to be able to pick this up off of surfaces or off their person and then touch your face. So what are people recommending? If you're able, have the person in a separate room. If you're able, have the person who's sick have their own bathroom. If the person has to come out and interact with people in the family, this is a perfect indication for one medical mask. And the reason is you want to put the mask on the person who's sick. And so if in our apartment, if I was sick and I had to come out and interact with my family, before I would leave the bedroom, I would wash my hands, I would put on a mask, and then I would go out and maybe I would sit down and eat food at the table. And then after that, when I was done, I would eat the food, I would put it in the sink, I would make sure that anything I touched, which is a very simple area on the table, is just washed, and then I would go back to my room. And so the point is to not have sustained contact with someone in your home who has this disease. You're going to want to take care of them. You're going to want to be in and out of there. How are you doing? Checking their temperature. Don't do it. If you're touching the temperature probe constantly to their mouth, that is where the disease exists. And then you're going to get it on your hands, and then you're going to touch your face. And so you shouldn't be scared to stay at home with your family with a fever if you have COVID-19. The vast majority of people are going to have a fever, body aches, feel like shit for 3 to 5 days, feel a little less shit on 7, and then they're going to start to feel better. You can start interacting with your family more as you feel better, as your fever is gone, but you're still going to be vigilant. You're going to be washing your hands. You're going to be a lot more confident 20 days out from the disease than you are 10 days out from the disease. The current recommendation from the CDC is that if I get sick and if I'm feeling better, I can put on a mask and go to work. And so I think that that is a good indication to you that that's when you can start interacting with your family, is that if you have COVID and you've recovered and you've isolated in your room for 7 days and you've been able to get food, and when you've been with your family, you've worn a mask and you're feeling better, come back out to your family's life, keep a mask on and wash your hands. And so I think that that is a very simple way to do it. I'm about to get to questions. I just want to make a few other small points because this is some stuff that's come up that's relevant in New York City. What do I do if I have a mild cold? And so I think given how rampant COVID-19 is at this point, I think if you have something that feels like a cold or you feel like you're getting sick, is take the precautions like you have COVID-19 for 1 to 2 days. If in 1 to 2 days you're feeling much better, and this is like the 1,000 other colds that you've had in the past year because you have kids, you don't have COVID-19. And then you can go back to your completely normal living at home life with your family. So I think it's just important. The place we get into danger is people being too cavalier when they're developing symptoms and exposing their family too early. And then when they get fevers and they're staying at home, is that they're having too much interaction with your family. You can have COVID-19 in your house and everyone else not get it and be protected and be completely safe. There are a couple exceptions to that, and I think this is important. If you have a vulnerable population in your family, so if you're living with your lovely 95-year-old grandmother, if there's someone in your house who had recent chemotherapy and someone in the house gets sick,
Claire,
you need to find another living arrangement for that patient or practice incredibly, incredibly strict isolation of that family member. We know that the older population is the sickest population when they get this disease. And so that is the one caveat to it's safe to stay home with your family, is if you have someone who's incredibly vulnerable, you need to
You're welcome, red like wine.
Set up a situation in the house where they're completely isolated from the person who is sick. Maybe you could have another person take care of that family member in your house so you have no interaction. But simply being in the home with someone with COVID-19 will not get you that disease. It goes back to the same 3 principles. It's touching a person or a surface who has COVID-19 and then touching your face.
I hope that this has put some misconceptions to rest for the majority of people who are panicking or watching fear-mongering videos. This is from a doctor, an ICU doctor. He works in the intensive care unit at Cornell Medical Center, the premier health facility in New York City, one of the premier health facilities in New York. So this is information that I feel is very, very valid for all of us who are scared of the unknowns. He really talks about the most important thing is protecting your face, touch, your hands. This is why all of our officials, the mayor, all of our elected officials are telling us, wash your hands, don't touch your face. But the wash your hands is the best information that anybody could have given us, according to this doctor, because science tells him that this is how it's being spread and contracted. So let me let the rest of this go. We're almost done.
And so lastly, for this, before I get to some of your questions, is when do you go to the hospital? And so I think probably the question that a lot of people are asking is, if I get COVID-19 and I feel short of breath, am I just going to go to the hospital and die? This is where I'm probably the most qualified person in the country to comment on what it looks like when people are coming into the hospital and sick. So first, who should go to the hospital? If you're feeling short of breath, come to the hospital. That is the rule. That is the clearest thing. It's not, I have a fever. It's not, I think I have COVID-19. It's not, I can't stop having those body aches.
You're welcome, Michelle.
It's, I feel short of breath when I get up to go to the bathroom. Those are people that should come to the hospital and be evaluated. At Cornell right now, what we're doing is a lot of the people that come to the emergency room, we're sending home to live out the 4 or 5 days of their disease so that they can feel better. And we say, oh, you look completely fine, go home. But what we're also seeing is that people that feel short of breath, who come to the hospital, some of them go onto the floor and just are short of breath for 5 to 6, 7 days, and then they go home. So of the entire population of people who get COVID-19, about 10% need to go to the hospital because they get short of breath.
You're welcome, Sandy.
Of the 10% who are coming to the hospital, about 1 to 2 to 3% of those are requiring admission to the ICU and to be put on the ventilator. So what happens when people get put on ventilators?
That was a hold on. This is important. He's going to talk about ventilators and what happens to the vast majority of people. But he said 1 to 2, maybe 3% of the people who come for coronavirus, COVID-19, are put into ICU. That's a very small percentage of the cases. He goes on to talk about ventilators here and how they're used and the recovery time. And he also talks about people with special underlying health conditions. So let's listen in.
Majority of people, overwhelming majority of people come off the ventilator. And they usually come off the ventilator 7 to 10 days later. But I think the important thing for you guys to know is going to the hospital is not a death sentence. It's a safe place for you to be. Go to the hospital when you're short of breath. Don't go to the hospital just because you have COVID-19. And then I think the question that we're going to get a billion times over, and I don't have a perfect answer for you at this point because it's different in every community, which is, should I get tested if I have the disease? If I'm a generic 35-year-old who's sick, I think it depends on the availability of testing in your community. What we know right now that people are home, is that if you have, and not having a lot of social contact, is that if you have diseases like, if you have symptoms like the flu, it's likely you have COVID-19. And nothing that I've told you about behavior, about interacting with your family, a lot of that stuff would change by knowing that test result. The caveat is if your community, whether that's New York or Tennessee, is testing a lot and you have clear access to testing, absolutely getting a test is a good idea, because when it's negative, then in a day when you're feeling better, you can have full interaction with your family. So I think that is the key. But if you live in a community where there's very rare testing going on at this point, do not try and jump the line to someone who's actually short of breath and really not doing well.
Thank you,
just
doctor.
to make yourself feel better, to know that you have it. Just take the precautions in your home that I said, and then as testing ramps up, then we'll be able to get more people tested. So I think I've discussed everything I want to discuss, and so if Dan doesn't have any other suggestions, then I'm going to switch over to questions, and I'll try and answer as many of these as I can. Dan, should I start with the top, or do you have a question? Didn't talk about it. There have been reports of infants and newborns who have contracted COVID.
They asked about infants and newborns.
We don't think that's vertically transmitted, meaning we don't think that it goes directly from the mom to the fetus. The suspicion is that it goes after, through contact. The thing that I think makes a lot of parents, doctor parents in this world, very happy right now is there's almost no COVID disease in the population from age 0 to age 14. So I'll just state that again. Kids are not getting sick. Now, there are some exceptions. You know, there's a recent New England Journal article where they went into a hospital in Wuhan, China, a pediatric hospital, and in the entire hospital of 300 kids, they found 2% of them or 4% of them had COVID, which really looked like cough or asthma. So kids are not dying. Kids are not getting critically ill. Kids are not getting sick. There's a whole debate about whether kids are transmitting this disease. It's probably true. But I think if the gist of the question is how does this affect infants and newborns, it's really not. From Bay, I keep reading conflicting information on whether COVID-19 is airborne versus droplet transmission. Do they absolutely know for sure? And so I think, if I know Bay well, this is a question about protecting nurses.
They asked if it's airborne.
And so I can tell you what we're doing in our hospital and what our experience has been. And so what we know is that the vast majority of COVID-19 transmission is droplet. And what that means to all the people on the phone call who don't know what droplet means is it's hands to face. So it's getting a droplet, so something that comes from your mouth, either goes onto your hand or falls onto a surface and then is very quickly taken up, touched, and put on the hand, and put on the face. So what does that mean, Bay, in our hospital? And so...
Okay, I'm going to stop it there just to reiterate what Dr. Price just said. COVID-19, the coronavirus, is primarily transmitted by droplets from an infected person's mouth onto a surface, then onto someone's hands, and then someone taking their hands and rubbing their face or rubbing somebody else's face. So the overwhelming majority of these cases are from transmission from the droplets from someone who's infected. And this is from a doctor. You know, are there going to be cases of some children from age 1 or newborn to age 14? Yeah, but it's very, very minute. There will be cases. There are cases out there. But again, that transmission came from their own family having the infection on their hands, the virus, and then touching that baby, touching the baby's face, putting a binky in the baby's mouth with coronavirus on it. The baby's going to get it. So let's let him talk and let's listen. Let's all listen up and let's not try to, have a debate here. Let's take in this information and let's process it.
The only time that we wear an N95 mask, which is to protect against airborne transmission, which is getting it just from particles in the air, is when we're doing something to a patient to make them spit a lot. So when we suction them or we do something to disrupt them, that's the only time. The vast majority, 99% of the time, or 90, that's not true, 80% of the time that the nurses are in the room with a COVID patient, they're just wearing a simple surgical mask. Only when they're doing things that are going to make them have to get secretions out or spit, which is called an aerosolizing procedure, are we using N95 masks. So the direct answer to your question is there's probably a small amount of airborne spread.
Sassy, we're all here.
For nurses, and I know we have a lot in our family, in Hong Kong and Singapore, doing those precautions, which is only wearing a surgical mask when seeing a patient and only wearing an N95 when doing an aerosolizing procedure, there was zero transmission to healthcare providers.
Zero.
We do have healthcare providers who are getting sick, and they're getting very sick. The people who are getting sick are one very clear population, which is healthcare providers on the front line who are having extensive contact with patients and not protecting themselves. So it's, for the most part, general practitioners who are in the office. In New York, it was 3 weeks ago, who didn't know that someone had the disease and spent 25 minutes in the room and then did a nasal, check their nose. And those are the people there that are getting sick. It's emergency room doctors who 3 weeks ago in New York City did not know the level of protection that they needed when they were interacting with people with active COVID-19 disease. What our experience is in our hospital, and we've been doing this now for 3 weeks, is if you wear the proper protection, you can interact with these patients indefinitely and zero people get sick. So good question, Bay. Jen Toadvine. We are wondering, being in a city, is it really safe to go on a run or a walk, taking in the social distancing measures?
Important.
Amazing question. Yes, please. If you're in a city, you can go outside. Just follow the rules. When you go outside, Purell your hands when you're going to touch the elevator button. When you touch the door, Purell your hands. Don't touch your face. When you're out walking in the city, don't come within 3 to 6 feet of people. But say hello, smile. No one is giving each other this disease by walking through a city. If there's a bike path, you can walk on it. The only caveat is just don't get sloppy. The problem with telling people they can do things is that everyone just assumes their old lifestyle. That is not what I'm saying. I'm saying it's safe in New York City, in Philadelphia, to go on a walk. Just follow the rules. Just follow the rules. I would encourage you to wear a mask, not because you're getting the COVID from people when you're outside. It's because as a society over the next couple of months, we need to train ourselves to not touch our face. And we need to tell people that we're taking this disease seriously. It's not because you need to wear a mask in the city, because that's how you're getting the disease. It's all back to the basic 2 to 3 rules. So yes, go outside, have a short walk, breathe, know that the world is going to be here, and then go back inside and follow.
Okay, let me just say something. Hold on. Somebody just said, isn't it safer to just stay at home? Rita's Juicy Life. If it's safer for you, if you feel it's safer for you, then do it. But I have been going out since this has happened. I live in New York City. I live in the 5 boroughs. I live in Nassau County. The highest amount of cases are here where I am. And I go out and I take 4-mile walks. I don't touch my face. I don't touch my eyes. I don't touch my nose. I use hand sanitizer when I come back in from the park. I'm not in close contact with anybody, and I'm not sick. And I go to work every day in a warehouse where there's numerous people, but we're taking the proper precautions inside the place of business because it's a necessity. It's one of the necessary fields that have to stay open. I go to work every day, and this is 3 weeks now, and I am not sick. And I don't think that I will get sick because I'm taking the proper precautions. So it's all about what you feel comfortable doing. But like the doctor just said, don't go outside and feel like it's life as it used to be. We need to be super duper cautious. He said you need to wash your hands vigorously all the time. So if you touch something outside, you better not be touching your face or your mouth or your eyes or your nose, because you're going to get coronavirus if you touch something that has the virus on it. So we have to be very cautious about what we do, but there's no reason to lock yourself in the house unless you're a very sick person and you have health, COPD, asthma, all all of the underlying conditions that they talk about. If you have that, then stay home, stay in. Or if you have to go out, take severe precautions and heed the warnings. Listen to this video. Listen to what a doctor is telling you. He said in the beginning of the video, all he sees all day long is coronavirus patients. I think this guy knows what he's talking about.
All the rules.
Dave,
Yes.
on the masks, do they have to be even the simple medical mask or like a bandana, for example?
I think a bandana is, at this point where the doctors and nurses don't have enough face masks, a bandana is a great idea.
Because it keeps your hands off your face. Yeah.
Exactly. These are not preventing you from getting the disease. This is only preventing you from touching your face.
Okay, so the reason for the mask is not to stop coronavirus from getting on you or in you from the air or from someone spitting on you. The reason the mask is there is it's stopping you from touching your nose, your mouth, and your eyes. You know, they even say wear glasses or wear goggles. I wear my shooting goggles at work. When I am in contact with anybody or if I'm out of my office, I put on my goggles, my shooting goggles. I look like a moron. I took a picture and put it on my community post. But I wear my goggles because I am educated. I know that if it gets in through your eyes, your nose, your mouth, I thought the ears, but he didn't talk about the ears. Masks, he just said it. They're useless. What they do is prevent you from touching your face with infected hands.
Okay, John Regan.
Dave, to interrupt, if you don't have Purell, any suggestions? Because a lot of places are out.
I'll get back to you on that, what people are using in the absence of Purell. I think that's another thing to say to Stella, is this disease is a wimp. Coronavirus is a wimp. It dies as soon as you disinfect it. So I can get back on the exact thing, but
he said coronavirus is a wimp. It dies as soon as you disinfect it. So if you feel safe, soul for music, then wear the mask. That's fine. It's going to help you because it will stop you from picking your face, putting your face, your fingers and your hands on your face. So it's good. He's saying it's good, but it's not good for what we are thinking it's good for. It's not going to stop you from getting it from breathing in the air or breathing in somebody else's air. It's that simple.
Just generally any type of disinfectant. And then if you're going out and you don't have Purell, press the elevator with your elbow.
Exactly, Josh.
Open the door with your shoulder.
As soon as I touch something, I clean my hands.
That's not going to get you COVID. Ideally, if you have Purell, all you need is a small drop. You're going to kill this thing. This thing doesn't violate the rules. There's not a mystery disease. And so I think that's a good point. But as to specifically if people are using things besides Purell, I'll get back to you. All right, John Regan, is a long car ride safe, say 10 hours? If no one in that car has COVID, you can drive for 200 days. And so I think as long as the person, if you're driving by yourself, it's completely fine. If you're driving with Michelle, as long as Michelle has been fine and is fine, drive forever. Kara, I would like to ask Dave if it is necessary to wipe things like groceries down with disinfectant when bringing them into the house.
Here we go.
I think the general answer to that is no. I think that, if you live in New York City, where there's a lot of contact with stuff that you're getting delivered, I think it's a reasonable idea to have the delivery person leave the food that they're delivering to you outside your door. You could probably pick it up with a glove and then just open the bag and all the inside contents are fine. That's an overabundance of caution, but I think is reasonable. What you don't want to do is high five the delivery man. You don't want to shake the delivery man's hand. You don't want to pick up the plastic bag that you're getting from Seamless and, have a huge, long interaction with that bag, because of course it's possible a delivery person has COVID. But again, if you follow the rules and everything you touch, you just clean your hands, you will not get it. Continue to order food. But no, I don't think you have to have routine groceries wiped down. Christina, I would like to know if it is irresponsible to go to Starbucks drive-thru. I think that's a complicated question. I think if the simple question is, Can both the Starbucks barista and you safely interact through that transaction? I think the answer is yes. Is it important that Starbucks and people that work there continue to have jobs? Yes. My general sense, given that we're all hunkered down, is to make your coffee at home.
Thank you, Gail.
If you're going to go to Starbucks drive-through, follow the rules. Wash your hands, accept the coffee,
Interesting,
wash
the
your
boss.
hands, and then drink your coffee. And what I mean is a drop of Purell or something equivalent to that. So if you can make your coffee and stay home, I would recommend staying home. You're completely safe to go to Starbucks. Just follow the rules.
Dave, there was one more grocery-related question, which is,
Yep.
what about your clothes when you come home? I guess it's beyond groceries, but like you go out and you come home, should you be putting your clothes in the laundromat?
Absolutely not. Absolutely not. That is a recommendation for healthcare providers, like for me, who I live in rooms with COVID patients, for 12 straight hours. For me, I will take off my clothes and wash them, and I have a whole procedure for that. For people who are generally going out, who are following the rules, wear your clothes. No problem. Stella, if you live in an apartment building and run out of disinfectant wipes, is there a good alternative? I will get back to you on the alternative. I'm sure the answer is yes. Okay. John Regan, if you become sick, how long should you wait before you go to the doctor or hospital? So I think we loosely addressed it, but I'll directly address it, which is don't go to the doctor, don't go to the hospital. The only rule for going to the hospital is if you're short of breath. What is amazing now is during the COVID outbreak is the use of telehealth. And so by far, if you feel sick and you're a little nervous, whatever your healthcare provider is, for us, it's, I work for Weill Cornell. We have Weill Cornell Connect. We have an army of doctors who are at home waiting to take your call, who will tell you
There you go,
that you have
That's excellent, Katrina.
nothing, or that you have COVID-19 and you should stay home. So do not go to the doctor. Do not go to the hospital. I would encourage you to use telemedicine, which is completely rampant right now because we have a ton of doctors who are at home and will take your call over the internet. Is there clarity about the incubation period if no signs? No, John, I think the incubation period is probably dependent on exposure. And so people who are exposed to a lot of disease, like an emergency room doctor who interacted with a patient for a long period of time without any protection, could be anything from a couple days to someone who who has an interaction with someone with very mild symptoms, and it can be upwards to 14 days, which is where the CDC recommendation is for people to stay home for 14 days. And then there's been the rarest of reports of it being beyond that. So I would say if you had a casual contact with someone and you don't feel sick at 14 days, then you probably are not going to develop COVID disease. Chris Solis, is there an emerging understanding or hypothesis surrounding contributing to why certain younger patients in their 30s and 50s have been having acute respiratory course compared to their peers? Are these patients truly healthy, or do they have comorbidities? So amazing, Chris, because I didn't have a chance to address this. And so, again, everyone listen, please listen to what I'm going to say. This disease affects everyone who's not in the age group of 0 to 14. So 23-year-olds, 35-year-olds, 45-year-olds with zero medical problems are getting this disease. People like that are coming to the hospital. People like that are going on ventilators. There is a very evil narrative early in this disease that said that this is only a disease of old people and people who have hypertension or people who have diabetes.
Thank you, Farmer.
That is not true. I can tell you because all I do is take care of patients. It hits the entire spectrum of ages. So that includes older people who do worse. We see a little bit more older people, but we see a ton of 35-year-olds. And we will understand it someday, but we don't understand it right now. And so it's not to scare you. Just follow the rules. If you can get this disease from age 20 years old, maybe 16 years old, all the way up to age 105, and you can get sick and end up on mechanical ventilation, on a ventilator. The younger you are, the less likely that is to happen. The older you are, the more likely that is to happen. But we see young people who get really sick, and we see old people who do just fine. And so I think it's a great question, Chris. I don't think we know exactly why young people are also getting sick, but it's just to say, follow the rules. If everyone does it, you're going to be fine. You're not going to get the disease. If you get the disease, follow the rules. You can protect your family. Most people will be fine. If you're short of breath, go to the hospital. So I'm just trying to make it as simple as possible. Mariana, what are the symptoms? What to do if you have them? Okay to use ibuprofen with fever. And so I think I touched on what the symptoms are. The vast majority of people are going to feel body aches. They're going to have a sore throat, and they're going to develop fever. Upwards of 90% of people are going to have fever. So I think that's what it looks like. Very interesting question about ibuprofen. We're not using it in the hospital anymore. There's really good data from Germany that there's worse outcomes in people, more inflammation in people who use ibuprofen. So that's simple answer, which is if you have a fever, take acetaminophen.
24, thank you for the super chat. Thank you for that super
don't use ibuprofen, use Tylenol. It's very simple. Connor, I'd like to hear a bit about what it's like treating these patients. A couple stories from the front lines on this thing. It's actually fascinating because they all look exactly the same. And so everybody has a cough. Everybody has a fever. Most people come into the hospital. They sit on the floor and they just have fevers. A lot will be nervous, which is completely understandable. They look like anybody else. What we see for people who get sick is they get short of breath, and then over 1 to 2 to 3 days, they get more short of breath, and then they get so short of breath that they can't walk to the bathroom, and then we put them on a ventilator. And then our experience has been that these people usually settle out over the next 1 day, and then between 7 to 10 days later, barring a complication, we're able to get these people off the ventilator. At Cornell, we're 14 days into this. Our first patient was a 39-year-old who is now home. So he was a 39-year-old who needed mechanical ventilation. He is off mechanical ventilation, and he is safely at home. And so, this is dealing with these patients is, for a doctor, incredibly simple. They all look the same. They all get the same treatment. For them, it's scary, and it's our job to kind of make them a little less scared. And what I tell every young person or old person that I have to put on a ventilator is, we're putting you on because we are going to get you off. And I think that that's true. So if you have people or you know people who are sick and they're short of breath, they shouldn't be scared. They should go to the hospital, and we will take care of them.
This doctor is amazing. If I was sick, I would want someone just like him. You heard what he said. We tell our patients, we're putting you on a ventilator because we're going to get you off. We're going to get you off this ventilator, and we're going to make you better. So, confidence, calming, what a great piece of video right here. This is the ultimate educational tool. Katrina, thank you so much for the super sticker. Thank you to everyone who has super chatted. This is my way of finding information that I feel is valid and sharing it with you guys. This is a chock full of information. I would suggest everybody watch this over and over again. If you haven't given me a thumbs up, I really appreciate the thumbs up and comments down below in the comment section. There's another 5 minutes to this video, but I just had to stop it here because I'm floored by the brilliance of this doctor. And if it hasn't made you guys feel a little bit better about it, then watch it over again. Watch it a few times and listen to it. This was from March 22nd, so it is from some time in the past, but not that far in the past. It's the 27th, so or the 28th. So again, this is valuable information. This is information that will put a lot of people's minds at ease. I know for sure that practicing proper hand washing continuously when you're coming into contact with a contaminated surface, and any contaminated surface could be anything outside of your home. And if your home's not clean and people are coming into it from the outside, then anything you touch in your home as well. As a rule of thumb, I would just clean my hands every time you touch something when you're on the outside. So.
Yep.
A few more questions that came in that aren't on your sheet.
Stash of N95 masks. You don't
Mine, I'm even thinking.
You do not need those masks. So I would, if you have a homemade mask or handkerchief and you can wear that, that would allow you to give those masks to your friend who's a doctor, your friend who's a nurse, your friend who's a respiratory technician, so that their hospital is adequately equipped.
The new normal. There's a question about the new normal. How long? Till there's a vaccine. Will there be spikes as people resume life? A related question. Do you anticipate second and third waves?
Yes. So I think this is incredibly predictable, and so I think social distancing will be for months to potentially a year. Which I know sounds like a lot, but I think the experience from Wuhan, the experience from Singapore, the experience from South Korea, is that the first thing you do is you flatten the curve. The first thing you do is you bring down the amount of cases so hospitals don't get overwhelmed. And then by human nature, people will become a little relaxed with their social distancing. And so there's then a second small spike. And then after the second small spike, it usually comes under control in the population. And so I think social distancing is something that you need to just put in your brain. I think it's something that is just the way of life for the indefinite future. But now that you know the rules, it's not something to be afraid of. It's just a different way of interacting. And as this becomes controlled over the next 3 to 6 to 9 months in this country, then you'll know exactly who you'll be able to hug. You'll know exactly who you'll be able to touch. You'll be able to, I think, feel better. I'd say the first focus for everyone on this call over the next 7 to 14 days is to learn the rules. Learn the rules, because as soon as you learn the rules, it's empowering, and then you can start living your life in a new normal, which will go on for 3 to 6 to 9 months.
One other question from Ed. If you are unaware you have the virus during the incubation period, can you infect other people?
Yes, I think the answer is yes. And so this comes from the cruise ship data. And so I think there was a big concern about asymptomatic spread, meaning people who never have symptoms of the disease, spreading it to people who then have symptoms of the disease. What we know from the cruise ship data is that asymptomatic spread, it turns out that most of the people who received the virus from someone else, the person who they received the virus from becomes symptomatic in 1 to 2 days. So it's likely that people who get this disease are shedding the disease 1 to 2 days before they have fever. So what does that mean practically?
Thank you,
Guy and Jackie. If you develop COVID-19 and have a fever, know who the people are in your life who you interacted with over the prior 2 to 3 days and let them know. Because then they can follow the rules. They can isolate themselves in their house. They can create a separate bathroom. And then after 2 to 3 to 4 days, if they're not feeling symptoms, they're probably not going to have COVID disease. So simple answer to your question, Ed, is yes, people transmit this disease. But I do not believe that there's this whole group of people out there who are giving this disease to everyone who would never develop symptoms.
Dave, are people becoming immune after they recover?
Yes, people are absolutely becoming immune. The stories you're hearing about people having rebound symptoms is usually the fact that they just haven't fully resolved the disease. So let me say that more clearly. So we know that from a day or two before you have the disease until about 14 days into the disease, that you're spreading the disease to the environment. We know that because scientists have done tests of the nose every single day to know which people are going to spread the disease. They don't do it to everyone, but the scientists know who those people are. What they have observed is that at 14 days, people will not be shedding the disease from their nose, but then at day 16, they will be. We don't think that that's because they've relapsed in their disease or not developed immunity. We think it's just because they're slowly coming down and the test is just picking up a little bit.
Excellent,
So
excellent.
the vast
question and
majority,
answer.
so 81,000 people in China got this disease.
Janet Cabana, thank you so much for that.
76,000 have recovered with antibodies that prevent them from getting the disease. Wow. The natural course of this disease is that once the world sees it, coronavirus now as a pandemic is going to enter the circulation the same way rhinovirus is in our circulation, the same way that respiratory syncytial virus is in our circulation. But as it mutates, it's going to get milder and milder. And so 5 years from now, you're going to get coronavirus, this exact COVID-19, and it's going to feel like a cold. Just not the first time through the population.
Two pregnancy-related questions. One from a nurse who's treating patients regularly, and she's asking, right now I'm screening people prior to my appointment with them. Is that enough in combo with hand hygiene? She works in wound and ostomy care. Ostomy?
Yep, yeah, absolutely. I think that is the system that is important, is screening people and hand hygiene. I think if you were doing ostomy care at the epicenter in New York City,
you're welcome to Ball
in a
Stundy.
Hospital where I've seen a lot of cases in the community, you could argue a simple surgical mask would be helpful. But if you're in a community that hasn't seen a lot of disease, screening and hand hygiene is everything. You don't have to wear a routine mask, and I think those recommendations from hospital systems are completely appropriate.
And our Christy, who's currently pregnant, is wondering if you've treated any pregnant women, and is it more severe at all in pregnant patients?
I've seen 0 pregnant women in our ICU. I think the data is that they're behaving like any generic person of that age. In other words, we're not seeing it more severe in pregnant women. In our hospital experience, we're seeing a male predominance to this disease. It affects men and women, but we're seeing more men. But we haven't seen anything unique to the pregnant population. They get COVID disease.
Thank you.
That's 100% true. But it's like a lot of people, which is they get it, they feel terrible, and then they get better. I wouldn't treat a pregnant woman like I would a 95-year-old patient or a family member. I wouldn't put them in seclusion. They still have to exist in society. You still have to take walks. Just follow the rules.
Mm-hmm. In terms of going to the hospital, you don't just have shortness of breath. If you don't just have shortness of breath, but or when you can't walk and breathe and have a fever, should you go to the hospital if you just have shortness of breath, or when you can't walk and breathe and have a fever? Like, do you need all of those things, or just the short?
Just short. I think I see them all as the same thing, which is it's shortness of breath. So if you're walking and short of breath, you should go to the hospital. If you're sitting and short of breath, you should go to the hospital.
So basically he's saying, shortness of breath in any way. If you can't breathe, just sitting down and you're having labored breathing, you go to the hospital. I mean, that's common sense. But it seems like all of the other symptoms, the sore throat, the coughing, the fever, if your fever is up high to dangerous levels, obviously you would probably more than likely have to go to the hospital. I'm not sure of the exact temperature. My wife would be able to tell me. But if you have a certain temperature, it's life-threatening after a certain point. So high fever, and more importantly, the shortness of breath. And the doctor is saying over and over again, follow the rules. This is the common thread that we're hearing from Governor Cuomo. This is the common thread we're hearing from all of our elected officials and people who are giving press conferences. Flatten the curve, social distancing, wash your hands, follow the rules. And, so many people are getting sick and infected, especially here in New York, because they're not following the rules. And Joey Brooklyn can tell you 100%. My friend from Brooklyn can tell you 100%. People are getting sick because they're screwing up. And they're just going on about their daily life like this is not life as usual ladies and gentlemen. This is different. We are living in a different time. And at the end of this all, we could look back on it and say, I survived the coronavirus. Makeup Officer, thank you for that super chat. Great stream, Rom. I listen while food shopping with my mask on, rubber gloves, and I am going to share on my community page. I think everyone needs to hear this. Excellent. So again, follow the rules, clean your hands, educate yourself. Don't be reckless. Don't be reckless. Okay? So this is almost done. This is just another 2 minutes.
If you have a fever, stay home. Chicken noodles.
Last question is on the Purell use. Actually, there's one more. Does it mess with the pH balance on your skin, rendering it useless?
No, but you'll get eczema. I'm joking. We are seeing a lot of people who have hand washing related dry skin, which is very common because everyone's washing their hands 100 times a day. But I think simple anti-infections per Purell,
my hands are like sandpaper,
is completely fine. There's nothing to suggest that Purell is not working, or I shouldn't say Purell, but hand sanitizers are not working. That is completely
Thank you, Mimi.
What about thoughts around herd immunity, like in the UK? What's your?
Thank you again, Guy and Jackie. Thank you.
I think what the UK is doing is completely incorrect.
Listen to this.
Herd immunity will happen, but to instantly allow a virus into a population and to get 60% of your population sick will overwhelm your healthcare system. And so I think everybody in the world right now is kind of pursuing a flatten the curve. People will get sick. Let's decrease the amount of people that will get sick. And over time, 18 months, the population will develop some herd immunity. The disease will get more mild. But that's not a strategy for right now.
So that's it, folks. Again, a very, very informative video. I mean, I watched that 3 times. Before I went live here, I watched that 3 times. It's available there on that link, and the people who did it, it's David Price, Dr. David Price, COVID-19 information. I believe it was a family member or a good friend of his that conducted that video, and that was by far the most informative, the most instructional, the most accurate information that you could get with the hand cleaning, the transmission of it. Granted, there's going to be other people that contract this virus in other ways that we don't know about, but the overwhelming majority of scientists and healthcare professionals, and those are the people, listen, when you have a crime committed, you call a cop. When you have a case or there's a murder, you call a detective, right? When you're sick, you call a doctor. We don't sit there and speculate and say, well, this one's doing this and this one did that. This happened to this one. This guy is seeing the most amount of patients with COVID-19. I have to say, I would go with what he is saying here, 100%. I share this with you guys because I love and care for you guys, and you guys are part of my family. So this is information that's very, very important to me. Here's the current. Let me get rid of this. Hold on a second. Stand by. This is the current United worldwide total: 660,706 confirmed cases throughout the world, 30,652 deaths worldwide, including 10,000 in Italy, 3,000 in China, 3,100, 2,500 deaths in Iran, 2,300 deaths in France, 1,019 in the United Kingdom, 639 in the Netherlands, and 517 in New York City, New York. So this is what we have going on here. U.S. is up to 121,478 cases. Denise, thank you so much for the super love. I appreciate that. Thank you so much. This is the coronavirus COVID-19 global cases by the Center for Systems Science and Engineering at Johns Hopkins University Hospital. 121,478 cases in the United States. And if you think it's not coming to your town, or that you have just a small amount of cases, that's being silly, because it's going to spread. It's going to come to your city. It's coming to a theater near you. Just use the information that I just shared with you. Now, that information is something that you need to put into effect in your daily life. 92,472 cases in Italy. When this is all said and done, this is my prediction, we are going to be over 250,000 cases in the United States. We may go over 250,000 cases. I hope and pray that I'm wrong, but that is my prediction. I feel that this is just getting ramped up right now. And the sooner people like us, everyone watching this live stream, everyone who shares this live stream, everyone who's watched that video, I think that video has had probably over 2 million hits. It's an important chock full of very good information, people. And I recommend you share that with your daughter, your sons, your friends, your family. Share that video, share my video or that one directly with everybody that you can. Put it onto Facebook, put it onto Twitter, share it. I'm going to share the crap out of it because I feel that it is very important. The sooner people understand that hygiene with your hands is the difference between life and death for many other people. So our mistakes can cost many other people's lives. And it's important and imperative that we stay educated on a continual basis. And we do not instill fear or panic into anybody. But heed the warnings from healthcare professionals. You're not going to go to a mechanic to get information on how to fix a broken leg. You're going to go to a doctor. This is a case for the healthcare professionals, for the scientists. And this man here has a chock full of information that I feel is 100% valuable to each and every one of us. Take it or leave it. But this is information that I am going to commit to memory, and it's going to be part of Bible for me. I've been practicing what this guy has been preaching for a long time. Yes, I live close to the airport. That was an airplane coming into John F. Kennedy Airport. Thank you for your detective skills, Daphne. Again, we're here live an hour and a half almost, so I'm going to end this live stream. This, again, like I said, is important information. I felt it was necessary to share this with you. 660,706 total confirmed cases of coronavirus. If you're not subscribed to my channel, please subscribe, hit the notification bell, follow me on all social media, all one word, DutyRon, DutyRon, on Facebook, on Instagram, on Twitter, and on all social platforms. Go to my website, DutyRon.com, DutyRon.com. There you will find coronavirus, COVID-19 drop-down sections in my website. We'll give you links to the CDC, to New York State, to the NYPD, New York City Police Department, the greatest police department in the world, the police department that I worked for 20 plus years. And I want to say thank you to each and every one of you for joining this live stream. I hope that each and every one of you heed the warnings, stay safe. May God bless the world. May God bless America, and each and every one of you for watching and being my friend. I appreciate you guys. Stay healthy, stay safe, and I'll catch you on the next one. Peace and love from New York City.